So hello, warm welcome to everyone. It's a pleasure for me to have you with us today for our fifth experience sharing session. And if we are here, it is under the umbrella of the movement for Immunization Agenda 2030 and our very first full learning cycle. So today it's our another experience sharing session with Dr. Francois Gaz and myself. And you know, we started the first peer learning exercise for this full learning cycle yesterday. That is the situation analysis. It was launched yesterday and it's going to run until it's going to run until it's a 4-week exercise that will run until the 15th of April. So that is the calendar I'm sharing on the screen. But one thing you have to take note of is that, let me just mute Clement, and then I'll have to be the one to give participants permission to unmute. So one thing we have to take note of is that this week we have two goals that we have to meet. The first one is to join peer grade. The first is to join peer grade. If you have not yet joined peer grade, please make sure that you do so as soon as possible. And the second thing is to download the rubric and the rubric and the template for the situation analysis. Those are the two key documents that you need in order to write up your situational analysis. And the peer grade is the platform where you have the possibility of submitting your situation analysis. So it's very important that before Friday, the 25th of March, you should have completed these two steps. And if you're having any issues, technical challenges with doing so, please meet us tomorrow at 4:30 p.m. Geneva time for our technical support session for the week. So if you have not yet joined peer grade, there is an easy step-by-step tutorial that has been prepared by my colleague Jean. I'm sharing the link with you in the chat. So take a few minutes of your time, go through that tutorial, and you'll be able to access peer grade without any difficulties. So, and then it's very important for you to watch the tutorial and you will access peer grade without any hitches. Another thing is you need to start writing your situation analysis right now, even though you will be, the deadline to submit is Friday of next week. That is Friday, the 1st of April, 2022. But you need to start writing right now. And for you to do so, to get started on the steps on how to do it, I'd like to invite you to watch this video from Reda that tells you, that shares with you the essentials of the situation analysis, the objective of this process. And I'm sharing the link also with you right here in the chat. Please go ahead and do so. Also, you have to download as I said earlier, the rubric and the template. That is, the rubric is the guidance document that you need in order to write up your situation analysis. I'll be sharing those two documents with you in the chat. So right now, I'm going to turn towards Francois Gaz, who is our guide on the side. We are always very happy and excited to have him with us. And I'm going to ask Francois to summarize in a few words, when we talk about situation analysis, what are we talking about, Francois?
Thank you, Charlotte, and hello to everyone present today on that session. And I'm looking forward to hear your challenge. I would like to say that when you have a situation analysis, the first step is to describe in a very specific way your challenge. And basically, to be specific on your challenge, you need to assess first, to answer first the questions: how big is a challenge compared to your overall objective to achieve, I don't know, to achieve 95% coverage or even 80% coverage in some district, you know, and you are at 60%, that gives an idea that you have to bring up your coverage by 20%. So that's, now your challenge could be a sub-challenge about the coverage that you have identified, and you need to tell us what is the weight of that challenge compared to all the challenges you may face to achieve your goal and your objective in your district, health facility, or country. Now, when you look at the weight, you need to also tell us, where is this problem affecting your district? Is it the whole district, the whole health facility, or part of the area the catch part in some health center served area? Is it a limited population group? We need to be very clear on is the challenge located, concentrated in some area. It's very important because if you want to do better, you need to focus your effort and your corrective measure where it has the most likely impact. The second step in your challenge we need to know is who is affected by your challenge. Is it a village? Is it one community? Is it a remote outreach area? And when we say who is affected, do they represent 10% of your district? Do they represent 50% of your district, like outreach? And why? The next question is why those people are affected by, are facing this problem. And those are the cause of the problem that you need to be very clear, and you may have to have several times the reasons why. Why do I have this problem in this area? It's very important before you find the opportunities to do better, which is a solution that will come later in that cycle. Now we are focusing on defining your challenge, the weight of the challenge, what you know, what you don't know, and need to know to be much more specific on the challenge or on the cause. Beware of your assumptions where you think this is a problem, but you have no evidence for the problem. Over to you, Charlotte. Actions we take later. I don't think we should focus now. We don't have time to focus on number 5, which were the action. We are focusing on the situation analysis for the time being. Thank you.
Thank you very much, Francois. And if you want to share your situation with us, please go ahead and raise your hand. But before that, we had Omar Apila Thomas that wanted to share his situation. So Omar Apila Thomas, I'm asking you again to unmute yourself so that you share your situation with us. Remember, Francois just said, for now, we are not looking at the actions or the solutions, but really we want to understand what is your challenge and what is the situation around that challenge. Over to you, and please do start again by reminding us who you are and where you're joining from.
Okay, thank you once more. Thank you for this chance given to me to express the situation I'm in. I'm Omar Lapila Thomas. I work for IMA, World Health, as a community strengthening service liaison officer, coordinating reproductive health and integrated outreach immunization services at the community level. As I stated before, this forum has really given me more strength on how to manage the challenges on the ground. I'm actually looking out from South Sudan, Juba capital. Briefly, just to go on the situation on the ground, which I personally am facing in terms of delivery quality services, specifically the immunization services to the community who are in need of the services. Because here we have a lot of challenges. One of it, you find that some communities are staying very far away from the health facilities, sometimes 15 kilometers away from the health facilities. So it is very hard for them to come and access the immunization services on a routine basis. And secondly, also, our roads is not all that okay, whereby sometimes, more especially during the rainy season, which we are entering into soon, sometimes it cuts other community from accessing the immunization services. However, the government actually trying very hard to make sure that each and every child should not miss the services, should not miss the vaccines, which is more valuable for the healthy life of the children. So the government is trying very hard to put a system in a way whereby there should be a national, the state and the county coordination on delivery of the vaccines to reach the community. But still the challenge is, although the vaccine is delivered to the community, you find that we have a lot of defaulters in the community. We have a lot of mothers who still come only want to access services and end up not bringing the child to the services due to other previous conditions which I've mentioned. And then also thirdly, you find some time when we do like an outreach we are taking the vaccine towards the community accessibility, you find that it's very hard also to find those mothers at home with their children, because the community are working in, they are the agriculturalist community, whereby sometimes they take their time in more in productive activities like the cultivations, and you find like more of their time they spend in the garden. And sometimes also you find that they shift with their family to the far areas where they're cultivating. So sometimes also they become very hard for us to track those kids, at least to make sure that each and everyone has to get the vaccines. But in my organizations, you find that we also come with a strategy to at least make sure that we increase the uptakes and we make sure that we track the defaulters. Initially, because we have the government, which is they have the program of the Boma Health Initiative on the ground, whereby you find the Boma Health workers identified in the community, and then they help in tracking and also giving the health awareness on the important of the immunizations. But now, as personally with my managerial team, we also come out with the issue of the community engagement meeting, which we see it very important to increase the uptake and to also track the defaulter. We engage the community leaders, we engage the community stakeholders to make sure that they are parts of the health care system. They should make sure that they also hold the healthcare services. They should make sure that the health of the child is their responsibility. And secondly, also, we also come with ideas that we need to form a male champion groups. Now, this male champion group is whereby we identified the fathers whose their children are fully immunized, they complete the immunization all. We form them into groups, we educate them, we make them to be a champion of change in the community, so that it will help us to also give the client information to their colleagues in the community, so that they will end up bringing those children which are still not completed the vaccines. And also we have other approach like the PDQ and the CAC, that is a partnership defined quality approach, and then the community action cycle approach, which is actually helping also me to make sure that we involve each and every partners, including the institutions, the stakeholders, the healthcare providers, the community stakeholders, to make sure that they should understand the important and the reason why it's very vital for a child to complete the immunization.
Right.
Thank you.
Yeah, he's right. I think, sorry, Charlotte, can interrupt. I think we need to focus here on explaining very clearly your situation with all the evidence. We are not today focusing on solutions. That I'm glad you have implemented those solutions. They will be very useful when we have session on solution on corrective measure. But for the time being, we need to be extremely clear on what is your challenge, what you know about it in terms of the way, why, and the size of the problem, and the cause of the problem. I think you have already covered a certain number of aspects, and maybe we need a little bit more clarification, but let's focus on your challenge and its specificity, including the cause. Thank you.
Yes.
Thank you, Francois. And I was just wanted to turn to you, Francois, and say, you know, I see, Thomas, you have already, you started carrying out some action, but what is still, what is the current challenge that you're still facing that is not enabling you to attain the objectives, your target objectives?
The major challenge which is still is, of course, we still have like, there's still a knowledge gap between the community. They still actually have that knowledge gap in understanding fully the importance of a child finishing the immunizations. Because if they are to have that full information or full knowledge on the importance of the immunizations, we thought it very well that they would not make their child to miss the immunization. They will not make their child to default from the immunization program. So the major thing is still the knowledge gaps, and also the cultural belief, which is still also affecting more the uptake of immunization. Because some community or some families still believe that the immunization you are giving, sometimes it causes the future impacts on the more especially the negative impacts on children. But still that one, we also worked us together as the stakeholders and also the team on the ground to make sure that we came out with a strategy to at least rectify this misconception.
Okay, thank you, Francois. Any questions? And please, if you have questions for Thomas, you can type your questions in the chat, or you can also raise your hand. You'll be invited to speak.
Just, I think I will let the people talk. I'm sure they have questions because you mentioned knowledge gap, misunderstanding, but before that even, what's your coverage actually? And how big is the problem that you are facing? I mean, how many people are not coming? Do you have evidence that all outreach are taking place? And if it's a knowledge gap, how do you know it's a knowledge gap and not another problem? More like the quality of outreach, that people don't know when the outreach is coming. How did you find out, and what's your evidence?
Yeah, just briefly to answer on that, because I said beginning that the person concerning more direct to the community, and sometimes we have community, the stakeholder meeting, the community engagement meeting. So we also measure in terms of how the community respond to the certain campaign, like assuming the immunization campaign. And also because here in South Sudan, we have several cultural background, and which in other terms it still affects this in terms of the knowledge. Because why I'm saying, because we find people are still following their cultural aspects and believe more on the scientific evidence-based knowledge on the immunization.
Yes, so it's you did special studies, special meeting that tells you. Now, in terms of the size of the problem, you say knowledge gap is a major problem. Do you figure out that if you solve the problem, the knowledge gap, you will resolve your problem, or you think you will face other problems?
I think with the experience been getting through this platform, it will help me to redesign a human-centered program to at least make sure that we cut the barrier, or we break the barrier on the immunizations. And if that one is done, more especially we can reduce the major challenge on the immunization chain in my community particularly.
What's a coverage? Currently, what is a coverage? And the dropout, you mentioned the dropout. What is the coverage and the dropout in your communities, in your area?
Yeah, in my community, there's no more evidence-based study conducted, but I think that is already what is in the pipeline. Because if you take, for example, out of 100 children attended let me take the Penta 1, you find that out of 100, maybe 80% who came completed the Penta 3, and that one shows that there's already a gap in uptake of the immunization services.
So you say 20% will not complete the coverage, the Penta 3. That's what you are saying?
Yeah.
But your current coverage in your community, you don't have data yet.
Yet there's no data yet.
You have no data. Okay.
Yeah.
And because you mentioned something very interesting, is that women they do cultivation, they get out with the children. So do you know what proportion of women are not there? You go for your outreach, integrated outreach, you have the logistic to do that in spite of the bad road or whatever, you arrive and women are not there because they went to the field with their children. Do you know what proportion affects your problems when you reach the community? How many of those women, what proportion of those women are not there, just not present?
Yeah, because in the community where I'm working, they are actually the community will depend on the agriculture soil, and more especially during the rainy season, people cultivate varieties of food stuff, and sometimes you find the distance of the garden they're cultivating is very far from home, so they tend to migrate from their original home temporarily to the garden site. and more especially they move with those children which are still breastfeeding. And for the immunization coverage to reach them, sometimes it's very hard because they are deep in the bush cultivating, and you find that most people are remaining at home. It is the elderly children, and with some men who normally come to access maybe food stuff from home to take at the garden. So currently I may not stipulate the correlations much, but this is what we also identify on the ground. Each and every time if we go for these outreach activities, we go for the immunization services, more especially the raining season, we find that the number of women found with children in the community, it is less than the women who normally go and access the garden services in the community.
Thank you. I think many people have their hands raised, and I'm sure a question to you that may be useful to describe even more specifically your challenge.
Okay, thank you very much, Francois. Thank you, Thomas. I was having a look at the chat, some of the questions and comments there. You've already provided answers to. So I'm going to invite those whose hands are raised. Please, Clement Mbaya Mukadi, are you able to unmute yourself? And we want to find out if your question is or comment is in line with the situation that has been described by Thomas today. You can go ahead and unmute. I'm also inviting Josephine Okide. Josephine Okide, are you able to unmute yourself? Okay, I see Clement Bayer, you are unmuted. Please do start by introducing yourself.
Okay, good afternoon, everyone. Actually, I was not to comment. I raised my hand earlier on to share
your
the
situation.
experience in my situation. Yes, not concerning
the
presentation. Yeah,
okay, so we are going to come back to you shortly. So if your hand is raised because you want to comment or ask a question to Thomas, I'm asking everyone. There's Martina Ezeama that I'm asking to unmute. There's Alta Samaela, Abebe Sosa, Josephine Okide.
Hello.
Okay, let's start with Alta and then we'll come back to you, Josephine. Okay, so over to you, Alta.
Good evening to you once more again. I'm Alta Samaela, calling from Nigeria, working together with the Nigerian Red Cross, a promoter of vaccine uptake in Jama local government, which is my jurisdiction. I think the most difficult challenge situation I've faced is how to bridge the gap between the physically challenged in the society in terms of COVID-19 vaccine uptake.
Alta, I'm sorry to interrupt you, but for now, we wanted questions. Did you have any question for Thomas, who shared his situation earlier on?
Yeah, I think for now, I perfectly understood the situation for Thomas. For now, I don't have any question for him for now.
Okay, so we'll probably come back to you. Josephine, are you able to unmute now? Josephine?
Yes.
Okay, please.
Thank you so much. My name is Josephine Okide. I work for UNICEF in Maiduguri, Borno State in Nigeria. I want to contribute to what Thomas shared, where he mentioned the issue of the women not being at home during immunization activities. From what I learned during the first week of this experience sharing, somebody shared a striking strategy, especially when you are not meeting the people at home. The person shared the fact that we need to study the characteristics of the community. If we know that the community people are not at home during the morning time or afternoon time, we reschedule our immunization activities to suit the community people. So we go to the time when we are sure that they will be at home, so that we will increase our coverage. So I'm just sharing this in case if Thomas can, since that is one of the major problems he has shared, that the women are not at home when they go for immunization activities. Thank you.
Okay, thank you very much for sharing that, Josephine. And we said from the beginning that this session is really about understanding the situation. Clearly, we'll probably be coming back to solutions in future sessions, but I think we can put this in the back burner for now, and it could help Thomas to ask himself further questions to understand better the situation. That is in terms of the times, the schedules, how they are planned, their outreach sessions. All right, so I'm going to turn, there is one last person we'll get to before we can listen to probably another situation analysis for today. That is, I'm calling Paul Jelemia. Your hand has been raised for quite a while. So Paul, are you able to unmute yourself? Paul Jelemia, I'm inviting you to unmute. Okay. If not, we are okay. Over to you, Paul Jelemia Sendama. Your mic is unmuted. Over to you.
Thank you. What I would like you to say on this group, I would like you to ask you if someone is just explaining about situation analysis. We would like that a person could show us and sharing his screen, showing how to develop those situation analysis, because and it's not that everyone have already captured each and everything and cannot understand each and everything easily, so that you can go together. Thank you.
Okay, thank you very much for expressing that concern, Paul Jelemia. I have a quick question for you. Have you been able to download the rubric, that's the guiding document for the situation analysis, as well as the template, the Word document? Paul, are you able to unmute again? Because since
hello?
Yes, have you been able to download the rubric and the rubric? That's a PDF version, a guiding document on how to carry out the situation analysis, as well as the template. That's the Word document that you use to fill your situation analysis.
Yes, I had already downloaded it, and I'm just passing through it since yesterday. And because we know that not everyone that who is participating in this group is aware and is very competent, because others it is the first time to participate in these sessions, and not only sessions, because it's because of the annual participation, they can face some of challenges. But if you could share the screen that we develop like this, as yesterday's leader was just doing, it could be very simple to everyone to understand and catch up the point.
Okay, thank you very much, Paul. That's why we have this experience sharing sessions, so that we can be able, from the experience of others, you understand better what is expected of you from the situation analysis. So we hope that if you come again on Thursday for our next experience sharing session, hopefully you know that for now, most people have not yet written anything in the situation analysis. They have not yet started. They are just starting the process. So we hope that in subsequent sessions, we'll be able to have people maybe share their screens and show us exactly how they have filled in the template.
Thank you. We are together, and we'll make sure we go and follow what you are doing, and hope we will succeed together.
Thank you too. All right, so I'm going to turn now towards Clement. Earlier on, I'm sure all the questions around, and I see comments in the chat. I'll ask Thomas to take a look at those, but I see we are almost out of time. That is, the session is only 30 minutes, but if we are going to go out of over time, because we respect your time, we are going to ask you if you want us to look at another situation analysis before we separate. You already know the drill. My question is, do you want some more? If yes, I see Syed Amma Hussein has already said more in the chat. Josephine Okide says yes. So please go ahead, type more or yes in the chat if you want us to continue, because we respect your time. And we also respect Francois' time, as well as mine, of course. All right. Okay, that's great. Wonderful. Many lots and lots of more and yeses in the chat. So I'm going to turn towards Francois. Francois, can we look at another situation analysis before we separate this evening?
Yes, and one little comment to clarify the work that you will do this week is to be as specific as possible on the problem itself, and basically to answer the question, how big is the problem you take as a challenge, and provided some quantified information compared to the objective you try to achieve, compared to the other challenge you may face. You want to be sure that this challenge, if addressed and overcome, will make a difference in the objective you have. And when you are specific, you have to find the second step. What are the causes? Why you have this problem? And when you find the first reason, you may dig in that reason why really this cause is a problem. Because the more you dig in the cause of the problem, the more you will find later on the right corrective measure, focus on areas that will address most of the problem. Thank you. So over to you for another problem, another situation.
Thank you very much, Francois. And please, if you have other things to do, if you're busy, you can, you are free to go for now. And the recording, you can still always follow the recording of the session later on to catch whatever you may have missed. So I'm going to ask Clement Mbaya Mukadi. Clement, I said we're going to turn towards you to discuss your situation. So Clement, over to you. Please go ahead and unmute yourself. Clement, are you able to unmute? Okay, over.
Yeah, yes, sir.
Okay.
Okay, good afternoon, everyone. I'm happy to be part of this platform. As it mentioned, my name is Clement Mukadi. I'm based in Botswana, in the Chobe district. I'm actually the head of preventive services, coordinating the preventive programs such as TB, HIV, malaria, and other programs. And EPI is one of them. To go straight to one of the challenges, there are many, but I could pick at least one, is a low coverage of immunization, especially for COVID, vaccination in the farms. Actually, my district is in the north part of the country, where we share the border with around the 3 countries, Namibia, Zimbabwe, and Zambia. And there is a mobile community working around. The farms where we have challenges, where we have illegal immigrants, whom when they are in, some of the farms owners, they don't give us access to this community. They don't give us a free access to vaccinate their workers. And one of the reasons is that since they are illegal, they are not, they don't have illegal papers, they think we may report them to the local authorities. And this brings a challenge for us to achieve our target, and sometimes not even knowing how many people they have and how many we've covered. We have this, we got this during the first wave, dose, which actually we had, among the intervention we did, we had to involve the local authorities. We approached them and we showed the challenge what we're going through, and they had to approach the farmer organization because they have a committee or union, and from there they tried to make our work a bit easy. We might reach a good number of them, even though we did not know the target and the number we expected. We went through for the second dose, and then from there we not get the same number. Like I'm saying, these people are mobile. Some went back to their countries and they are in and out, in and out. It makes us difficult to achieve, I mean, to know the really target, the real number we have. But as of now, the most challenge now is when it comes to the booster. We have started covering the community with the booster dose. And of this, I think if we have done something much, should be around 30% of the expected, because we have used the first and second dose as a baseline, and we expected to give the same, to vaccinate the same number when it comes to booster dose. I think in short, that's what I have to share with the team. But like I said, I appreciate this a platform. Actually, it's benefiting me not only for EPI, but other programs, especially when it comes to situation analysis. I try already to make some projection in some of the programs which are suffering. Using this model, I think I will reach somewhere. Thank you very much.
Thank you so much, Clement, for sharing this experience with us. I would like to find out from you, can you share with us, do you have, and I'm sure this is a challenge that is faced by most districts that are most border districts in several countries, but I wanted to find out from you, do you have data in terms of coverage for the first dose, the gaps in coverage between the first, second dose, maybe the second dose, the booster dose? How many people, do you have an idea of how many people are involved as far as your target population is concerned? And if you were going to reach those people, how much will that contribute to your target coverage? Clements, are you able to unmute again? Please go ahead and unmute yourself. Okay.
Yes, yeah. But have the target, the coverage for whole district. For first dose, we are around 86%, and the second dose, we are around 80. I mean, around 70 something, because we are still, it is still ongoing for some who were given a bit late in the later stage. But for the booster, for that community, like I said, we are using the first, even though I don't have the exact number, but the estimation done by then, I think by ESE for last week, estimation, we are around 30%. And of this is using the first and second dose as the baseline. So this was an estimation, but I don't know the exact number to give us of now. This is the exact number, but in terms of percentage, that is that.
Thank you very much. Yes, Francois.
No, I think it's thank you very much for sharing the challenge. That's very understandable. So if I understand well, get me right, you know, you have a little dropout, bit less than 10% between first, second dose. It's nice to hear, but 86% was quite a high achievement. And you wonder why you have, you know, why is this problem of the first was very high, and why now particularly, do you understand the true reasons why it's only 30%? Is it temporary and people will come back? The booster at 30% is a raising question. Do you know really why there's such a drop between the second dose and the booster? That's my main question. Or you don't really know, you can guess, but you don't have real figures.
Yes, I can try to guess. The first one is that, like I'm saying, the difficult people are the owners of the farms. We are tempted to reach out this community, but we found that they do not want to release the staff for vaccination. They think because of the side effect, once they are vaccinated, it may impact on their schedule. So they don't release the community to come for immunization. And the second, I guess, second reason could be some of them could have gone back to their countries, and we don't know if they're going to come back or they've gone forever. That is one of the reasons. And among the intervention we're thinking, we're discussing with my team was, why can't we, since they don't want to release the staff during the day in the morning or anytime for immunization, can we try maybe to go and vaccinate them in the evening while they are done with their work? So this is a way we are looking to go that way if it may help.
So basically, I think, thank you for sharing that. I think it becomes a critical challenge, you know, the cause of the problem. You mentioned IA5 as one cause. You mentioned that maybe it's just the wrong timing of the day. You mentioned some resistance of farmers to register illegal immigrants. You mentioned they may not come back, but these are sort of a line listing of assumptions, but you don't know really the most important cause.
Yes, sir.
Yeah, and maybe that's something that if you you try to understand the weight of each cause, maybe you get some information that will help you to succeed, because Botswana is a very successful program in general and a model for many countries. So basically, I think I'm impressed by the way you're monitoring those issues in spite of the unknown. But I think knowing exactly the why will help you to get the right strategy that may not solve all the problem, but have an impact on the problem you try to resolve, which is the dropout between the second and the booster particularly. Thank you.
I appreciate it.
Okay, thank you very much, Francois. Thank you very much, Clement Mbaya Mukadi. So there are good numbers of hands raised. Those hands have been raised long before Clement had the opportunity to share his situation. And I know that some of the hands raised, you want to share your situation. We may not be able to listen to you today because of the time, but we can as well just invite you to unmute so that you share, and then we can use this. Others who are in the room can go back to think about it, and probably during our next experience sharing session on Thursday, we could get to discuss on one of the situations that are brought up today. So I'll just do a round, starting by you, Alta Samaila.
Thank you again once more. Just I earlier been mentioned, my greatest challenge here is try to bridge the gap between the vaccine uptake between the physically challenged person, because the gap in my own community here is very big. And the greatest challenges I'm facing is in terms of transporting the physically challenged to the vaccine center. Thank you.
Okay, thank you very much, Alta Samaila, for that question, for that challenge that you have shared. I want to find out from you just one question for today: is what is the proportion of the physically challenged persons in your community? What part of the target population do they make up?
They make up the 20% populated in my community.
Is it possible to move instead the vaccination teams towards the people instead of having them move to the vaccination centers?
Yes, I've been trying to do that, but it has been costing me a lot of financial problem, because at times they are very much available. Getting to the vaccine center or the local government trying to transport the vaccine officer is also another challenge that I have to transport them. Also, in terms of feeding, I have to feed them for the number of hours they have to stay to vaccinate such a physical challenge person in a particular setup, where at times I do put them together.
Okay, and I see Saeed Amma who's saying that is asking in the chat, just reading my mind, say 20%, what kind of physical challenge are we looking at in this situation? What are the physical challenges?
Yeah, they have different. We have the blind, the cripple, the blind, those that cannot even move an inch, that I have to go at times house to house, bringing them out, using my bike at times to take them on my machine down to the vaccine center. And there are many of them, they are of age.
Okay,
yes,
Francois?
One question, I understand the burden, but is it possible, do you know if there are some, you may be caught by a village where there are 2 persons who face this physical challenge, and then you have another village that will be 10. Are you able to prioritize, given the cost and the efforts? Are you able to make a priority with the data you have, because you have limited time, you have limited resources, to do it. Is it possible for you to get a more clear vision on where you should focus by priority if you don't have all what you need to do, everybody?
Yes, I think that's what I'm trying to do for this week. I'm
Excellent.
trying to prioritize to see how I can check out my strength and my weakness in terms of vaccine uptake for the physical challenge person.
Okay, that will be very clear, very interesting to hear the results at the end of the week of what end up with your prioritization exercise to where you focus on where you will have most of the results.
All right, thank you.
Okay, thank you, Francois. Thank you, Auta. And Syed asking why not arrange outreach sessions in such condition that Syed Mirabansha he just indicated that issue of resources to be able to transport vaccination teams as well as the feeding of those who are carrying out the vaccination. So I think we can listen to one last person before we separate today. That is Aliyu Ibrahim. Aliyu Ibrahim or Yakub Akulo. The first to unmute. Okay, I'm turning. Okay, Yakub Akulo, over to you. And please do start by introducing yourself.
Yes, good afternoon. My name is Yakub Akulo, a pharmacist and a pharmacy vaccinator trainee. I'm from Ghana, from Jura-Setu-Domasi district. I wanted to contribute to the fact that the contributor has made concerning the fact that transporting physically challenged to the vaccination site is actually his main challenge. And I think that the alternative should have been getting more vaccinators going to the communities, visiting the homes. So home visits should have been the option. So I think this is the contribution I'm making. Thank you.
Okay, thank you very much, Yakub Akulo, for sharing your contribution. And like I said, we are taking all those into consideration. And one thing I would like to highlight is the IDS engine is still open. And if you're listening to some of these challenges or the situation analysis, you can, and you have an idea or a practice that you're carrying out in your context to overcome this challenge, you can still go ahead right now and share that challenge in the IDS engine because it's still open, so that when the time comes, when time for solution and actions come, the challenge owners can always refer to the ideas and practices shared in the IDS engine, and these will inform them on what to do within their context. So really, I want to thank you all for sharing today. I want to thank Thomas, Clement, Auta, Samaila, and you, Yakub, for sharing, as well as Josephine, and all those who have been leaving comments in the chat. I know we have another appointment on Thursday that is at noon, 12 o'clock Geneva time. So if you were not able to listen to you today, we do hope that we'll have the opportunity on Thursday to look at your situation and to discuss it further. If you have not yet downloaded the rubric and the template, the word template for the situation analysis, I'm sharing the two documents right now in the chat. You can click. Once I share them, you can go ahead, click directly and download them right now into your PC or into your device. So I've just shared the rubric in the chat. Right now, I'm also going to share the situation analysis template. Now, if you have not joined, remember that the first step, the first thing you have to do this week is to join a peer grade, is to join the full learning cycle in peer grade. It's very important. If you have not yet done so, there is a tutorial that has been prepared, a very detailed and clear tutorial that's been prepared by my colleague Ja. I'm inviting you, I'll share the link with you right now in the chat. I'm inviting you to go and to watch this tutorial and try to join peer grade, because if you don't join by Friday, you may not be able to join again. So if you are not able to join and you're still facing any challenges after that, let us make it a date tomorrow for our technical support session. That is at 4:30 p.m. Geneva time tomorrow. Join us for the technical support session. I'm sharing the registration link with you in the chat as well, so that you'll be able to join us, and we'll be there to support you and to ensure that you are able to access peer grade and that you are ready to submit your situation analysis when the time comes. So once again, I want to thank you all for the active participation, the comments in the chat. If you found that this session was useful, if you learned something from it, I'd like to invite you to go to our announcements channel on Telegram to say why you found this experience sharing session useful and why it is important to join them. Also, the last thing I'd like you to do, if you are in front of your computer, if you are in your office, no matter where you are, whether you are alone, I'm inviting you to unmute yourself. I'd like you to put your hands together right now and clap for Thomas, for Yakut, for yourself, for participating in this session and contributing to the situation analysis.
Thank you so much.
Hello.
Thank you.
Thank you very much. Thank you.
Thank you. Thank you.
Thank you,
Yeah,
everyone.
and
Thank you
Charlie,
so much.
very wonderful session.
Okay.
Thank you. Bye bye.
All right. See you tomorrow, technical support session, and on Thursday for
Bye
another
bye.
experience sharing session.
Thank you. Bye bye.
Peace.